Anatomy of the muscle. There are more than 600 skeletal muscle in the body. Half of the body's weight is muscle tissue. Skeletal and cardiac muscle. Skeletal are more than the cardiac. Muscle, along with the skeleton, determines the form and the contour of the body. Function of the skeletal muscle: body movement, maintaining posture, stabilizing joint, and generating heat. There are three types of muscle: skeletal muscle, for example, muscle of the arm, and smooth muscle, for example, muscle of the viscera or gastrointestinal system, and cardiac muscle, for example, muscle which surround the heart. Criteria of the skeletal muscle: it is voluntary, striated, attached to the skeleton, produce movement of the skeleton, and supplied by somatic nerve. Attachment: mostly to origin, which is characterized by less movable, mostly fleshy. You can see here the color of the muscle, which is shiny or fleshy, and it is located in the proximal end. Insertion: characterized by mostly movable. You can move your ankle joint or your foot, and mostly fibrous. You can see here the tendon of the gastrocnemius and soleus, and it is located in the distal end. Types of attachment: muscle are attached to the bone, cartilage, or ligament by tendons, which is cord or of fibrous tissue. Aponeurosis, which is a thin, broad, and strong sheath of fibrous tissue. Raphe, which is an interdigitation of the tendinous end of the flat muscle. Here you can see the tendon of the gastrocnemius and soleus, and here in color, in green color, it is the aponeurosis of the external oblique muscle, and here it is the raphe of the, it is like this. Here you can see the aponeurosis, and here the tendon of the biceps brachii. Direction of the muscle fiber: we have parallel stripe-like, for example, sternocleidomastoid, which is located in the neck, and we have the flexor pollicis longus, which is located in the anterior palmar aspect of the forearm. It is unipinnate like this. And we have the rectus femoris, which is bipinnate, located in the anterior aspect of the thigh. And we have the deltoid, which is triangular in shape, and it has multipinnate of direction of the muscle. For example, deltoid, it is located in the shoulder. We have also in a circular direction of fibers like orbicularis oris, which is the muscles around the mouth, and we have parallel fusiform like the biceps brachii, which is located in the arm, and convergent fibers like the pectoralis major, which is located in the pectoral area. In the abdomen, we have the external oblique outside. It has direction of fibers like this, external oblique, and we have internal oblique under it, and under these we have the transverse abdominis. We have in the midline here linea alba, and between the linea alba we have the rectus abdominis. Naming of the muscle according to the size. We have major and minor. We have maximus and minimus. We have latissimus, and we have the examples of these naming. Longus and brevis. Brevis means short and longus means long. And we have these examples: gluteus maximus, gluteus minimus, latissimus dorsi, and adductor longus, adductor brevis. According to the position, we have muscle in the pectoral area like pectoralis major and minor, and according to the depth, we have superficial like superficialis and deep like profundus. Externus means external. Here we have the muscle of the human being. In the facial, in the face, we have epicranius and frontal belly, orbicularis oculi, zygomaticus, orbicularis oris. In the neck, we have sternocleidomastoid and sternohyoid. In the thorax, we have pectoralis minor, pectoralis major, and serratus anterior. Intercostalis, the abdomen, we have rectus abdominis, external oblique, internal oblique, transversus abdominis. In the thigh, we have the tensor fasciae lata, serratus, adductor longus, and gracilis, rectus femoris, vastus lateralis, and vastus medialis. In the leg, we have the gastrocnemius and soleus in the posterior medial aspect, and in the anterior lateral aspect we have fibularis longus, extensor digitorum longus, and tibialis anterior. In the thigh we have rectus femoris, we said that before, and in the pelvic we have iliopsoas, pectineus. In the forearm we have pronator teres, brachioradialis, flexor carpi radialis, and palmaris longus. In the arm we have triceps brachii, biceps brachii, and brachialis. In the shoulder we have deltoid and trapezius. And in the face we have masseter and temporalis in the temporal area. Name for the muscle according to the shape. We have deltoid, which is triangular in shape, teres, which is round in shape like pronator teres, rectus, it is straight like, for example, rectus femoris and rectus abdominis. Number of the head, we have 2 head like biceps brachii, and we have 3 head like triceps brachii, and we have quadriceps which has 4 head. According to the attachment, the action, flexors or flexor carpi, flexors like flexor carpi radialis longus, and extensors like the extensor muscle. In the back of the body we have in the neck epicranius, occipital belly, sternocleidomastoid, trapezius, and in the shoulder we have deltoid, infraspinatus, teres major, rhomboid major, latissimus dorsi. We have in the hip gluteus medius and gluteus maximus, and in the thigh we have iliotibial tract, adductor magnus, hamstrings muscle, biceps femoris, semitendinous, semimembranous, And in the leg we have the gastrocnemius and soleus, fibularis longus, calcaneal tendon, muscle of the forearm, brachioradialis extensor carpi radialis longus, flexor carpi ulnaris, extensor carpi ulnaris, extensor digitorum, and in the arm we have triceps and brachialis. Summary of the skeletal muscle. Skeletal muscle are striated, voluntary, and muscle attached to and move the skeleton. They have two attachment, origin and insertion. Their fiber may be parallel or oblique to the line. They may be named according to the size, shape, number of head, position, attachment, depth, and the action. Smooth muscle found in the wall of the viscera, not attached to the skeleton, not striated, supplied by autonomic nervous system, so they are non-voluntary. It is completely different with the skeletal muscle. Cardiac muscle, not attached to the skeleton, striated. It is striated like skeletal muscle, supplied by autonomic nervous system, so it is an involuntary muscle, but it is autonomic. It is still contract if they are isolated from the autonomic nervous system. It depends on the conduction system. The autonomic nervous system is to modulate the action of the heart. And in this schedule we have the difference between each three type of the muscle. There are about 60 muscle in the face. Smiling is easier than frowning. It takes 20 muscle to smile and over 40 to frown. Smile and make someone happy. Thank you.